Hi, my name's Tom Backley, and I'm the CEO of the Beach Cities Health District. And 2023 marks 25 years of preventive health success at Beach Cities Health District. For the last 25 years, we've been leading the way in the beach cities by providing direct programs and services in our community. This anniversary is a celebration of all of us. It belongs to all of our volunteers, cities, elected officials, school districts, businesses, community members, residents, and staff. This is our chance to share our story and envision our future. We have much to celebrate, and we look back with gratitude and pride. BCHD was established in 1955, and South Bay Hospital opened in 1960. As healthcare changed and hospitals became more business-oriented, the district made the decision to close the hospital in 1998. At that time, the board decided to shift its purpose to focus on preventative health and the health and well-being of our community. Looking back on the success and impact we've all made, the decision was so innovative and forward-thinking and has truly benefited our community.
In 1998, the board envisioned a community where we could keep people healthy and out of hospitals. We looked at what was happening in the community around healthcare and realized that having a hospital that was empty, that didn't have the kinds of resources that other local hospitals had, was not good for the community. And we wanted to transition that to something that would be more effective. So we went upstream and we looked and we thought nutrition, we thought fitness, getting into the community, getting people moving, getting people eating well, and helping people to stay out of hospitals. And we switched from that reality of illness care to a wellness care model.
We know chronic diseases are preventable through lifestyle management. At every age, there are things you can do in our community to keep someone healthy. So we have worked with youth, adults, and older adults to create a healthy beach community.
Our partnerships with the school districts, parents, and volunteers have been instrumental to the success of our Liberal Kids program. This comprehensive school garden and nutrition program was created in 2007 in response to the high rates of obesity among Redondo Beach elementary school students. Today, we've seen a 70.5% decline in obesity.
I really think the program is important because a lot of kids don't really know where does food come from. They go to the grocery store, they might see it on their plate when their moms fix it, but it's really opened their eyes to seeing it from start to finish. I've had parents come up to me and say, "Oh my gosh, you're the garden docent. Oh my gosh, my kid eats vegetables now," and they hug me. I'm crying, sorry. And it's the most extraordinary experience to introduce something new to somebody and see it come to fruition and then want to see you again in the garden. This program through our school district is amazing because it's supported by the Beach Cities Health District, and they're the ones that are behind everything that goes on. And if they weren't here, then I don't think these programs would exist.
We've also made great strides with our focus on mental health and substance use prevention. Recent data from the California Healthy Kids Survey show the percentage of Beach Cities 11th graders who reported using alcohol or drugs in the past 30 days, dropping from 43% in 2018 to 18% in 2023.
Beach Cities Health District has done a fantastic job in aligning itself with what the schools need. Something that I really appreciate about Beach Cities Health District is they don't just think about their programming, they first begin with the school's program and then they start to build their program around what the school needs.
Beach Cities positively impacts our students, particularly with regard to our first two board goals. That second goal is to create a culture of care in every classroom and on every campus. And when students feel good about coming to school, safe at school, we know they're more engaged in academics, which informs our first board goal to maximize the academic excellence of every student.
It's like a value-added relationship. It's a partnership. There's synergy between Redondo Beach Unified and Beach Cities Health District. We are not able to do all the things that we do in terms of providing resources, programs, services to our students and staff and families without Beach Cities Health District. And there's so much we wouldn't have, like our Kids Live Well program, our employee wellness program, the fact that they helped us put together our morning exercises program, Alcove, access to this amazing resource for our students. There's so many things that we wouldn't have available without this partnership. When I think of it that way, I recognize just how valuable the partnership is.
In 2010, the Beach Cities Health District brought the Blue Zones project to our community to specifically address the needs of adults. What it does is that it uses environmental and policy changes in local schools, restaurants, grocery stores, and our city governments to measurably increase well-being. We've seen dramatic increases in exercise and life evaluation and decreases in smoking and obesity. And through all this work, in 2016, Beach Cities was certified as a Blue Zones community. We make the healthy choice the easy choice.
The eyes of the nation are on you. That what you do here, long term, is going to change the health of the entire nation. People need models to get back the health of our nation and give us back our social lives, all the things that matter to us.
Our team here in the Beach Cities, their job is to visit every restaurant, every grocery store, and every school with the best practices in setting up the designs of those buildings so people are nudged into eating a little bit less and moving a little bit more. In the last 3 years, we've seen over 2,000 people join Moais. We organize them around walking, but the point of it is not walking. The point of it is creating new friendships. We find that people who join Moais, 60% of them stay in them for many, many years. So this is about that idea of building your own tribe. We found that after 2 years, the average person living in this community boosted their healthy eating by 9%. This is for 125,000 people, by the way. So these numbers are significant. Exercise went up, or physical activity went up by 10%. Smoking dropped by an astounding 30%. That's the #1 driver of healthcare costs, of avoidable disease, smoking. And we saw a 14% drop in obesity. What does that mean? That means that there are 1,600 fewer, your friends, your neighbors, your family, 1,600 fewer overweight and obese people in this community than there was when we started.
Beach Cities Health District has helped Hermosa Beach create a healthy beach community by partnering with us and shepherding us over the years in creating a smoke-free city, both indoors and outdoors, indoors in public facilities and outdoors throughout Hermosa Beach. This allows community members as well as visitors navigate our city from end to end without having to worry about being in an environment that has cigarette smoke.
I saw an article in the local newspaper that said that Beach Cities Health District, which at that point I really didn't know a whole lot about, and they were going to have a meeting to set up walking groups. We met people that we would not have met otherwise, who have become like family to us. And through all the great periods and the not so great periods, they have stuck with us and with me. We have celebrated birthdays with them, holidays, special occasions. One of the things that was a real bonus from working with the Moai, especially with our walking Moai ocean walkers, is that when a member of the Moai needed help, other people were there to help them. We had one person who had breast cancer. She was diagnosed with breast cancer, and she needed rides to the doctors, and she needed rides to chemo. People in the Moai were arguing over who would get to take her. There were that many volunteers. We had another member who, at age 87, was losing his eyesight and needed to use a white cane. But he could still walk because one of us would be on either side of him. And he was lethal with that white cape. And then when my husband passed in February, these people showed up to help. They were all just a wonderful support group.